Hi there. My name is Dawn Richardson. I'm here representing myself, Parents Requesting Open Vaccine Education, the National Vaccine Information Center, and I'm opposed to House Bill 2249. First, I want to say that I am so proud to be a Texan. Garnett and I go way back in this position, and many of you here as well. As the Director of Advocacy for the National Vaccine Information Center, I monitor a lot of debates in committee on the floor, and Texas, we do it respectfully, we do it thoroughly, and we do it right. We're definitely a great example for the country, whichever side you fall on this issue, so I just want to bring that up. 20 years ago, Rebecca Rex and I started Parents Requesting Open Vaccine Education, and after about 7 years of working with thousands of families, we did pass the conscientious exemption. And it was a lot of work, and I am so excited to see this whole new generation of young moms here today that have utilized the exemption to help their medically fragile children to be able to protect them from further vaccine injury, and it chokes me up a little bit. Proponents of House Bill 2249 have labeled it the Parents' Right to Know bill, but they have no qualms using it in misleading families of vulnerable children about what a safe school really is. This bill sets up schools to be designated as winners or losers in the quest for universal vaccination. There is inherent bias in this bill. I'll just point out that the bill does not require the designation of those cases reported by the health department of incidents of vaccine preventable diseases to be marked with which ones were vaccine failures. That is evidence of bias. They don't want to hear that. They want to report the numbers of the exemptions in the schools and the number of vaccine preventable diseases that happen. So somehow correlate those two together. The information is out there about those who get the disease that's vaccine preventable, that they have been vaccinated. The health department has it. We get it all the time. As a matter of fact, with the recent mumps outbreak, we wrote to the health department and found out that most of these mumps outbreaks, almost all of the kids are fully vaccinated. They have that information. So this bill is definitely biased. The other problem is it doesn't give the information to the schools on all of the diseases that are out there that no vaccine exists for. And I've got a huge list that I'll provide for you later. Also, vulnerable children, this was mentioned before, are already surrounded by numerous adults in the school system who don't have the schedule of vaccines that kids get. And I'll leave you with these later. 69 doses of 16 vaccines by the age of 18. I know some of the parents and some of the nurses have mentioned that they are vaccinated, but not to this degree. Vaccines fail. I have the evidence that you asked for on pertussis vaccine because the vaccine fails to block transmission. It suppresses symptoms, and I've got a lot of information on mumps that I'll give to you that I don't want to use at my time. I can do that later. Why do groups like the Immunization Partnership mislead the public about vaccine exemptions and school safety and exploit the concerns of parents with vulnerable children? Because bills like this one, and I'm working on these in multiple states right now, are part of a documented legislative strategy published by the National Vaccine Advisory Committee in 2015 to create centralized repositories of specific community-level vaccine usage data that local groups use public health officials could use to identify and locate groups, small groups, of those who don't accept all ACIP recommendations. I heard that the information is de-identified. I get that. But at a time when vaccine rates are at or near historically high levels and substantially higher than when the Texas vaccine exemption law was expanded in 2003, the documented end goal of bills like this one is to put community-based pressure on those who have declining confidence in vaccines because of safety, efficacy, necessity, or cost concerns, or who have religious objections. It's to create a lynch mob mentality. You've heard about this from other families. House Bill 2249 is a bill in search of a problem that doesn't exist. What's missing here today are any real live examples of healthy or vulnerable children who have vaccine exemptions who have caused ill health, death, or disability to a child in a school. I didn't hear about 100,000 in the United States. I didn't hear about 100 in Texas. I didn't hear about 10. I didn't even hear about one real live child who's immune compromised or immune vulnerable that suffered because another child who had an exemption spread disease to them and hurt them.
With respect, can you bring it to a close, please? Your time is out.
Sure. The only transparency here is seeing through the false pretense that the lowest vaccine exemption rates creates the safest schools. Thank you.
Members, any
Thank you.
questions for this witness?
Let me ask you this. So,
Representative Zedler.
Thank you.
in your testimony, you said the actual vaccination rates have gone up when the suggestion is that the exemptions have gone down.
Well, or the exemptions have gone up? Yeah, right.
Oh, yeah,
right.
the number of exemptions
Yeah,
have
and
gone
how
up.
does that work? How do you have
right.
exemptions? Okay, it's an interesting situation. Most people don't realize that since 2000, that vaccine schedule has actually doubled. And the health department also has on their website, and we've footnoted in our information, every single vaccine has gone up since 2003 in their rates. Like DTaP in 2003 started at 95.7%. It's now 97.4% statewide. You've got the hepatitis B. It started out at 97.2% in 2003. It's gone up to 98.1%. So, and that's kindergarten. I can get this chart to you. And then for 7th grade, the same thing has happened. DTaP in 7th grade, we added a booster in 2009, 95.5%. It's up to 96.9%. So the way that the state has been tracking exemptions and releasing data, an exemption is an exemption regardless of whether it's one dose of the 69 or all of them. And so there's been a lot of misinformation, I know not by committee members or any legislators, but by vaccine advocacy groups that have just thrown this number, 45,000 vaccine exemptions throughout the media, claiming that we're at risk because this number is exploding. The truth of the matter is the vaccine schedule has doubled over this time period. So naturally, parents are going to be using more exemptions. And there are close to 200 new vaccines in development right now. Many of these are going to be targeted to be put on the mandatory schedule. And so at that point, you're going to expect a lot more. And with this mumps outbreak that we just have been hearing about, the Advisory Committee on Immunization Practices just has announced that they're seriously considering a 3rd dose required. Well, when that comes out, a lot of these families, they're looking at the efficacy of 1 dose, and if they're going to start taking some of these exemptions because they're not going to want to over-vaccinate for measles and rubella. That's irresponsible. There are many families who use the exemptions also who have children who are fully vaccinated. We get emails from parents who, like the doctor gave the kid the vaccine 4 days or 6 days before their first birthday, and they don't know what to do. They're not going to revaccinate, so to meet the requirements, they will go ahead and use an exemption. We've had families whose children have had medical situations come up who are fully vaccinated, but because the state is considering sometimes increasing the number of doses, they want no more further doses, so they're considered fully vaccinated. As a matter of fact, the Advisory Committee on Immunization Practices, I have a document here, they say 22% of the exemptions out there are in kids who are vaccinated to some degree. So we're not even comparing apples to apples. We've got situations where you have kids who are exempted who are also vaccinated. So focusing on that is a little bit misleading. But the main point to answer your question is that the schedule has doubled, and yeah.
Okay. Thank you.
Mm-hmm.